Back, genetic testing and mastectomy, two words being tossed around a lot this week after movie star Angelina Jolie went public with her decision to undergo a double mastectomy to decrease her chances of getting cancer. This morning, we're joined by Dr. Kelly Martinez, a surgeon with the Breast Center at St. David's Medical Center. Good morning to you.
Good morning.
So when you first heard the story about Angelina Jolie, what did you think?
I thought she made a wise decision, and a decision that was based on good clinical medicine to reduce her risk of her future risk of getting breast cancer.
Are there women every day in Central Texas making this decision?
Yes. So we see breast cancer patients that are evaluated for their risk of having a genetic abnormality. We see patients that come in that are concerned that they may have a risk. And we see patients that see people like Angelina Jolie, and then it sparks their interest in knowing a little bit more.
If you're at home right now and you're thinking, you know, should I consider genetic testing? What are some of the similarities that you might see in your own life that she saw in hers, her own mother dying of ovarian cancer?
Right, so people that have a genetic abnormality that predisposes them to breast and ovarian cancer typically have multiple family members with cancer. And it's not just breast cancer, and it's not just women. So a family history of a male breast cancer is significant, multiple family members with breast cancer, early age onset of breast, history of ovarian cancer, and history of other multiple cancers.
And the way I understand it is it's a pretty lengthy process. I think Angelina Jolie said she started it all back in February and just now ended it, and now, of course, went public with it. But how long can it take from start to finish?
Well, the genetic testing is a blood test or a saliva test. Those results take about 2 weeks to get back. And then depending on the type of reconstructive surgery depends on the length of the time of the surgery, the multiple procedures, and the recuperation time. So we say immediate reconstruction, but what we really mean is we're immediately starting that procedure at the time of the mastectomy. Most patients will require more than one surgery to complete their reconstructive process.
And is it a 100% guarantee that you will never get breast cancer or ovarian cancer?
No. So our risk-reducing surgery is the single thing that we can do to reduce the risk more than anything. But it doesn't reduce the risk by 100% because we know we don't remove every last breast cell. So we say that we reduce the risk by over 90%, but it is not a risk reduction to 0%.
Well, Dr. Kelly Martinez, thank you so much for being with us this morning.
Thank you for having me.
You are welcome. We'll have this information and links to St. David's Medical Center on our website, and let's turn it over